Kirsten, hello.
Hello?
I looked at your daughter's X-ray and CT scans. She has the condition craniosynostosis, which we suspected. The images show that her suture has fused prematurely.
Okay.
Babies' skulls have openings called sutures, which allow the brain to grow. Brain triples in size over the first year and keeps on growing until they're about the age of 12. Tell me more about the symptoms.
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her, but I was sure something was wrong. She's in a lot of pain.
She has the condition craniosynostosis, but her brain shape is almost normal, so that probably made it more difficult to diagnose. Craniosynostosis is complex, and many doctors have difficulty detecting cases like your daughter's. As the brain is growing, it needs to be able to have room to grow. It needs to be able to push the skull bones apart, giving it more room. And if the growth is restricted because of a fusion in the suture, then intracranial pressure forms, which can be very painful.
So, what are the options?
Well, we've got to reduce that intracranial pressure, and the only way we can do that is with surgery.
Surgery? Well, that sounds really dangerous. My pediatrician said it could be fixed with a helmet.
If the sagittal suture hadn't fused, then maybe a molding helmet would work, but it's too late for that now. Every surgery has risks. This one has as much as the rest because it's a head surgery. It's a head surgery, so therefore the risks are greater. There are just as many risks.
Well, I'm really concerned. What exactly would this surgery involve?
We have 2 options. We can either perform the minimally invasive procedure because she's 6 months old, or we can do the traditional surgery. I'll explain the difference between the two. With the traditional surgery, we start with an incision at one ear. We move across the skull to the other ear, and that's the only scar that forms, and the hair usually hides it. Once the incision is made, the affected areas of the skull are removed. We create an opening for the brain to grow, and we reshape those bones, replace them in a normal manner, and once we're done, the incision is usually closed using, dissolving sutures.
This sounds really difficult.
Yeah, it's a big procedure. It's complex. It requires the expertise of a number of specialists working together.
Well, if Jenny has this surgery, do we know that she'll be without pain afterwards?
Now, there's no guarantee that there'll be no pain at all. Sometimes children have a little bit of pain that we can control with medication. Sometimes there's situations where we have to do another surgery, but that's pretty rare because the success rate is very high. It's over 98%. We've been doing this for a long time very successfully.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So, what about the other procedure, the minimal one?
Well, the minimally invasive procedure, it's endoscopic, and we normally do it when the baby is young, typically younger than 6 months. It involves using an endoscope to open the suture. It only takes about an hour. She'd have to spend a night in the hospital. She'd probably come home after that. After that, she'd have to wear a helmet for about 6 months, and we'd have to check in every 3 months to make sure that the sutures weren't closing early. It's a simple procedure, but it can be successful when the baby's young.
Okay. Is the helmet painful?
No, it's not painful. It's custom made, so there's no problem with that. The success of the procedure depends on how frequently she wears the helmet. After about 6 months, we'd know whether the growth was normal or not. If it's not normal, then we might have to do another procedure. The second procedure would be the longer traditional kind. Both options are complex. We'd have to work with a team. My team includes plastic surgeons and neurologists.
This is all overwhelming. How do I decide what's best for Jenny?
It's a lot to mull over.
So you're sure she needs surgery? The molding helmet alone won't work.
She's had fusion that has to be corrected surgically.
Okay. How do I get more information?
Probably talk to your pediatrician about that.
This is so stressful.
It's a lot to think about. Let me give you a pamphlet that has information about craniosynostosis and your treatment options.
Okay, thank you.